Okay, wonderful. I think we should begin. Thanks so much, everyone. Good morning, everyone, and thanks for joining us for this exciting panel to celebrate the International Women's Day. My name is Jennifer Moles, and I'm the Director of R&D Collaborations and Commercialization at the Ontario Centre of Excellence. As an organization, it's an opportunity to raise awareness and the progress made towards achieving gender equity and acknowledgement that there's still more work to be done in this particular space. This year's UN Women's theme is Gender Equality Today for Sustainability Tomorrow. In keeping with the theme, OCI is supporting from 111 are thrilled to be hosting this panel on discussion of connecting women and technology. So we're going to showcase some tremendous females here, as you can see on the line, and in our ecosystem, and highlight some ways that we can collectively give women in the technology sector a seat to the table and see ourselves representing those that we can look up to in a leadership position. Before we begin, I want to acknowledge the land that we gather here today. So OCI, our workplace, we take place in traditional Indigenous territories across the province of Ontario. We acknowledge that there are 46 treaties and other agreements that cover the territory that we now call Ontario. We're thankful to be able to work and live with these territories, and we're thankful to the First Nations, Métis, and Inuit people, and who have cared for these territories since immemorial, that we continue to contribute the strength of Ontario and to all the communities in the province of Ontario. And just one little tidbit about myself, I'm from a very small town near a native reserve. And so I've been entrenched in that community for quite a long time. So this is really great that we're now going forward and moving forward and acknowledging these communities. So OCI would also like to thank its provincial office in the Toronto and Territory and many nations, including the Mississauga Credit, Anishinaabe, the Chippewa, the Haudenosaunee, the Wendat, and people that are now the home to many other diverse First Nation communities, Inuit, Métis, and other peoples. We also want to acknowledge that Toronto is covered by Treaty 13, which is signed with the Mississauga Credit, and the Williams Treaty signed with multiple Mississaugas and Chippewa bands. Acknowledging traditional Indigenous territories is one of the most recognizing contemporary and historical Indigenous presence and land rights. It's a small step towards dismantling the continued impacts and colonialism and undoing Indigenous reassure in everyday lives. So in this morning, thank you everyone. So in this morning's discussion, we're going to hear from individuals who found a way to put first through healthcare innovation in the province and in Canada, actually. So we're welcoming today Roxana Zaman, who's the COO and the co-founder of Maple, and Ashleigh Kennedy, who is the CEO and co-founder of Neurovine. So they'll be joining the meeting, and we'll be going together to listen to their insights on their journeys in healthcare and bringing forward these technology companies. So now I'd like to start with introducing Roxana. So Roxana, do you want to introduce yourself and tell us a little bit about Maple and sort of how you started your journey with the company?
Happy to. Thank you, Jen. It's really a great pleasure to be here today, especially on such a meaningful day celebrating women. So happy International Women's Day to all. So as Jen mentioned, I'm Roxana Zaman, and I'm one of the co-founders and chief operating officer at a company called Maple. If you haven't heard of Maple, we're a technology platform that connects Canadians with doctors and other types of healthcare providers in real time, typically in minutes, anytime, 24/7, 365 days a year. We started the company about 7 years ago to empower the health and well-being of Canadians and to help improve the sustainability of our healthcare system. Today, we have more than 3 million Canadians that are directly connected to Maple, and we have more than 1,600 doctors and healthcare providers in our network. If you think of the busiest emergency department in the country, which I believe is located in Brampton, Ontario, and if you think of the amount of patients they see every day, Maple is seeing multiples of that volume every day with no physical infrastructure. So all patients are seen and helped virtually. So we're making a meaningful dent, I would say, in the number of medical visits that occur every day in our country. In terms of how we started, so the company has 3 co-founders, myself included, Stuart Starr, who's our Chief Technology Officer, and Dr. Brett Belchitz, who's our CEO. Obviously, with a physician on our team, we quickly became aware of the challenges that Canadians face when it comes to accessing healthcare in a timely manner, as well as our healthcare system coping with an aging and growing population. So there's a lot of pressure on our healthcare system to continue delivering care to everyone who needs it. For examples, in terms of some meaningful stats, I think 50% of Canadians have to wait a day or more to be able to see their doctor. 15% of Canadians do not have a family doctor, myself included. I'm an immigrant to the country. I moved here when I was 12 from Eastern Europe, and I still haven't been able to secure a family doctor. And I think what's not surprising is that many of these inequities have been growing larger as a result of the pandemic. And we've really seen over the last couple of years the struggle that people have had to go through to get access to basic care that they need. So Maple really flourished during this time. And as a founding team, we were incredibly passionate about helping to solve some of these challenges and providing Canadians with quick and convenient access to care when and where they need it. So that's a bit about me and a bit about Maple. So Jen, I'm happy to throw it back to you.
Wonderful. Thank you so much, Roxana. Yeah, very, very exciting times. The world of technology, really in the healthcare space specifically, has really thrived during the pandemic, and so we'll be interested to hearing a little bit more about your company in a few minutes. But now I'd like to welcome Ashleigh Kennedy to the panel. Ashleigh, can you tell us a little bit about yourself and about your organization?
Yeah, definitely. Thanks for having me here, Jen. This is a great opportunity to, discuss some of the progress that we're seeing in the healthcare industry for sure. So I'm a neuroscientist by training. I'm the founder and CEO of Neurovine.ai. Neurovine is a company that combines wearable technology with artificial intelligence to deliver prescription digital therapeutics to patients recovering from a brain injury. So whether the patient has sustained a concussion or a stroke, the platform that we have built and continue to build is designed to really deliver targeted early intervention to support these patients along the recovery journey. The genesis of the company was that I was a clinical researcher actually at the Toronto Rehab Institute, and it's a really innovative facility that has new technologies being piloted all the time. And we saw that putting technology in patients' hands, involving them in the recovery journey, completely changes the recovery trajectory. It decreases the cost of care, and it significantly improves mental health. And for brain injury, mental health is one of the biggest predictors to a good prognosis, a full recovery. So that experience kind of opened my eyes to the importance of technology in the recovery journey. And with my co-founder, who's a physician and actually my husband, we 3 years ago launched Neurovine. It was supposed to be a small company. It's now a platform solution that, we build our own hardware. We have built and validated all of our algorithms and software architecture. So it's ended up being quite a robust offering. I've got more than 3,000 concussion recovery sessions that we've been able to provide over the past year. Again, during the pandemic, it's been an awesome opportunity to work with our patients virtually. and to be that solution that connects them to their clinician.
Wonderful. Thank you so much, Ashleigh and Roxana. So I'd like to go into a little bit further to talk about some questions here. So a commonality between both your organizations is that you're enabling the individuals to have some type of personalization and ownership of their own personal health experience, which is something that we're finally moving towards in the year 2000s and above. Can you maybe starting with you, Ashleigh, can you talk a little bit about why you founded the company and the importance of how it separates your organization specifically, in the area of, you just spoke about more patient involvement and having the patient be the owner of their recovery journey. So can you talk a little bit more about that and why you decided to move forward in that space?
Yeah, absolutely. Growing up, my dad played professional football, so we had a lot of his teammates who ended up really struggling from mental health, and lost one of his friends to suicide when I was quite young. And that early experience really highlighted the massive impact that brain health has on an individual's life. Their economic, their ability to work, their ability to have a family and build a life. It can be really impacted by concussion. But until recently, it's been very taboo to talk about brain injury. So people would hide this and really not seek the help that they needed to recover. And so that was part of the logic to creating a technology that was clinician prescribed, but really driven by the patient. And so the patient, some of that, the kind of uncomfortable feeling of getting help for brain injury is removed, especially with some of our athletes and military personnel that we work with. This is a solution that they can use on their own. They don't have to, divulge it to everybody that they're getting help. But I think more importantly, we see patient engagement and self-efficacy unlocks everything. And when a person feels like they're in control of their recovery journey, they take the extra step to do their homework, to do their therapies at home. We see them starting to change things like nutrition, as well as just getting outside and getting more exercise. So we're used to having that kind of control in every aspect of our life, with Amazon delivering your pasta the next day. You run out of pasta, you order it the next day. We need that in health too. We're demanding that in healthcare. So that combination of self-efficacy and the consumer on-demand expectation has really allowed us to thrive in this season.
No, I like how you just put that, the consumer on demand. In the last two and a half years, everyone's lives have changed, and you're correct. We're constantly ordering things to come the next day. We're doing whatever we can in our own homes, as opposed to going out into the community. We're trying to take ownership of many different things in our lives. Thank you for sharing that experience. And now moving on to Roxana, if you want to talk a little bit about how it's very interesting. Your application that you provide has definitely turned patient-physician communication on its head. So if you can talk a little bit about that, that'd be great.
Yeah, I'm happy to. So I would say that the customer experience means everything to us at Maple. And it's been like that since day one, since we founded the company. And it's a core principle that we follow when we design products and build services. So it really stays at the core of our strategy and our platform. And I'll share an example in terms of how this concept of customer experience being a unique differentiator for the company, for any company, to kind of make it come to life. So back in 2015, when we started the company, we certainly weren't the first, 3 founders to think of coming up with a virtual care service. There were quite a few well-established players in Canada. But the way that their virtual solution worked was very different. So you actually, as a patient, had to physically travel to a clinic, have an appointment, and then you would do your virtual visit at the clinic over an iPad. And you still had to schedule that appointment, and sometimes it would take you days, and you still had to travel, and you would do the video visit that way. And so we looked at ourselves and we said, what if we could just do the virtual visit? What if you could just log in from your phone or from your computer, from anywhere, whether you're at the office, at home, traveling abroad, and within minutes, you're connected to a doctor right away. And our principle, again, just keeping that customer experience in mind, we wanted to eliminate as many barriers as possible between patients and physicians, cut out the travel time, cut out, the triage. Oftentimes you talk to a coordinator, someone who kind of intakes your symptoms and then passes on the information to the doctor. So we wanted to connect patients to doctors right away. The way that our model works, it's sort of similar to Uber, and I don't like using other companies, but it's easy to kind of visualize it. But every day on the Maple platform, you've got hundreds, sometimes thousands of patients logging in every day saying that, I want to see a doctor. And on the other end, you have this massive network of doctors with phones in their hands, and there's notifications coming through. Patient is requesting a consultation. Would you like to see it? So our doctors review every visit and they triage it right away. So there's no one in between you and the doctor. And that was a perfect example of starting with the customer, starting with the patient, understand their pain points, and focus on solving those pain points as much as possible. And I'm really proud to say that today as a company, we have more than 300,000 five-star patient reviews. And I think, our small but super mighty team is doing something right. I think if you're looking to start a company or you're relatively early on, knowing your customer goes a long way, understanding their problems and making sure that, you're there to help solve their issues. I think that's what we sort of owe to our clients and our customers, to be able to truly help them and add value to their day.
That's wonderful. Thank you, Roxana. I really like how both you and Ashleigh have talked about the patient experience and ensuring that we have, better patient outcomes, and, how can we, support those that need assistance in those particular indications. And the one thing that I would say that's very interesting about Maple is that, you said it at the beginning of the meeting, there's so many people that don't have physicians. They don't have a regular physician. So what do? This has helped to reduce any sort of wait list, even in a walk-in clinic environment. And then when there was no walk-in clinic environment that you could go to during the pandemic, this opened the doors for those that needed to ensure that they were supporting whatever mental health concern or crisis that they were going through in real time, and without having to leave their place of work for a long period of time. And it's difficult for some people, and they don't have that luxury to be able to do that. So so this is great. Thank you so much. Moving on to the next question. This time we can start with you, Roxana. Can you talk a little bit about how organizations like OCI and 111 have impacted your work, and what does it mean to be with an organization that first has been connected to these types of players within the ecosystem in the province of Ontario?
Yeah, thank you for the question. So reflecting back, Maple moved into 111 in 2017, shortly after we launched to the public in Ontario. In terms of the size of our team, it was just the 3 founders and 2 developers. So we were very small, and frankly surprised that Maple was able to get into such a prestigious scale-up hub. So we were very proud by joining 111. And I think OCI and 111 did a number of things for us. Number one, it gave us credibility with investors and corporate clients to be associated with a great name such as 111. I think 111 did a great job in terms of building its reputation and its brand. So being associated with that was helpful to us. It gave us a beautiful physical office space. And when you're just starting up, you can't underestimate the importance of having a legitimate looking office. When you've got clients coming to meet you or investors coming to meet you, I think it goes a really long way. Sometimes I really believe this, but you do have to fake it till you make it. And 111 was a great help for us in that sense. I also think it felt really encouraging and motivating to be alongside other founders who are just as hungry, and they're facing similar challenges that you are, reinventing industries, doing things that have never been done before. And I think just the atmosphere and overall culture is something that we really enjoyed. Being able to attract talent, it went a long way for us. And I still remember our, glass office space, and those were some of our fondest memories, growing from a team of 5 to 20 to 30, and eventually growing up and leaving the space, but always being a part of the hub for sure. I would also say being able to get to know other founders and of course the staff at OCI and 111. I know you truly care about these companies, and there's been a number of introductions that were made for us. One super noteworthy one is an introduction to Morneau Chappelle, now LifeWorks. So Maple and LifeWorks have been partnering for quite some time, and we do a significant amount of business with LifeWorks today, particularly, as we look to help navigate the mental health care space. Maple is quite active, but we still have so much work to do. And LifeWorks brings a huge strength in terms of their EAP program and other services they provide. So that relationship came directly from 111 for us. I think, your staff is also, like I said, passionate about helping founders with day-to-day challenges, no matter how small. I remember particularly one day, we were spending maybe tens of thousands of dollars on Facebook advertising, trying to grow our business. And all of a sudden, Facebook just shut down our ability to advertise, and no one there would talk to us. And I remember Siri, and I think your head of marketing at the time, who got involved and pulled every string they could to get us a contact at Facebook to talk to us to resolve the issue. And it did get resolved. So these are little things that, they might seem small, but they mean so much when you're a founder, and oftentimes you don't know where to go for answers, and you've got this network to support you. So I think both organizations should be very proud in terms of the work that they do for Canadian startups. And we certainly feel very proud to be part of the alumni group.
Wonderful. Thank you so much, Roxana. Moving over to you, Ashleigh, if you could talk a little bit about the supports that organizations like OCI and 111 and others within the ecosystem, have been able to provide, and sort of, how it's resonated specifically with Neurovine.
Yeah, definitely. So OCI, they were one of our early investors, and I think probably met me before any other investor has ever even spoken to me, and kind of tracked us and were supportive in other ways other than financial investment right from day one. So we're an Invest Ottawa company. So in Ottawa, the OCI team sits at Bayview Yards, and so there's nice collaboration between a lot of the early companies at Invest Ottawa and OCI. And so, the team at OCI really have been champions in our corner. They believed in our vision from day one, and, very vocally have been cheering us on, sending messages of encouragement, and really involved in that journey. They've made important connections for us as we've scaled, beyond just Ontario, looking into commercialization strategies in the United States. So those connections and advice about how to navigate that process have been helpful. They've provided a platform for thought leadership. So, I've been able to be on panels with Minister Vic Fedeli to talk about, some of the limitations that we have in scaling the health technology sector. These are all opportunities that have been provided by OCI. And then, of course, we were lucky enough to get financial investment. And at the time, those were dire days, and it really changed the trajectory of our company. So yeah, having somebody just believe in the vision and put their money, behind the support was really, really crucial for us as a company.
Great, thank you so much. Well, I've had the pleasure of seeing you pitch, and your passion as well is what helps, us drive forward and get excited to, further connections and make those introductions, etc. So, I'm so happy that both of you are on the call today, and just looking at your passion about, what you do and how you do it. So, and you are making a difference, and it's very important. The next question I have, this time I'll start with you, Ashleigh. What advice would you give to other female leaders, who are finding a gap in the ecosystem and looking to get more involved in the technology field?
Yeah, so I think sometimes as women, we feel like we need to be overly prepared to take on a new task. Particularly when we don't see anybody else building or creating the thing that needs to be created. I think we can sometimes be our own worst enemy in terms of, well, I can't build a solution to do that because I don't have XYZ. I don't have an MBA. I don't have 3.5 years of experience. And I think if you are seeing a need and, you've got the fortitude, the gumption, the passion, you gotta be real solid to really passionate about what you're doing, to step out and to build something new, to kind of fill a gap in service, or fill a gap in an industry. If you feel called to it and you're passionate to do it, I think ignoring all of those negative voices in your head that are telling you you're not the person to build it is essential. So that would be my advice: is like Roxanne said, get really curious, have as many conversations as you can with the people who are experiencing the pain point. But when you jump off the cliff, do it without paying too much attention to your own thoughts that might be limiting you. That would be my advice.
That's good. Thank you so much. Roxana, if we move it over to you, sort of, what advice would you provide to, other females that, to help them move towards a leadership role?
No, I think it's such a great and important question. And I think I can piggyback off of what Ashleigh just spoke about. And so my advice really centers around surrounding yourself with supportive people and teammates. I think part of my success, I owe it tremendously to my two other co-founders. And, they're always rooting for me, and we have very deep respect for each other, and we have a great working relationship. We all have very different skill sets. So as Ashleigh was saying, don't feel like you have to know everything. Early on in my career, being an individual contributor, I think I just got really good at trying to be a perfectionist and trying to know everything. And I think the more senior you get in your career, you actually realize that the less you know about things. Ambiguity is very real. You're faced with decisions and situations that you've never encountered before. And so I really believe in this concept of building diverse teams. If you can, as a founder, partner with people who have different skill sets than you. So in terms of Maple, to illustrate, we've got Dr. Brett Belchitz, who's a doctor, and he brings a lot of the industry and healthcare expertise to the company. He also has tremendous relationships with doctors and healthcare providers across the country. He understands government regulation and privacy requirements. So he's got healthcare covered. Then we've got Stuart Starr, who, started his career in investment banking, decided to leave that behind and teach himself code. And so he's just a brilliant mind when it comes to building technology. And he's very, very passionate about building things and figuring out how things work and architecting different solutions. He really is a genius. And myself, I've got a business background, very focused on product, P&L management, operations focused. And so I bring the business lens to the group. And early on, when we had nothing and we just had a concept, we sold the three founders a lot as a team. We said, we might not have all the answers today, but we think that between the three of us, we can build something really great. So we really brought healthcare technology and business expertise together. When we started out, we saw examples of many failed attempts to build what Maple is building. And, we knew doctors who thought seeing a doctor on your phone was a great idea. And so they wanted to get that started, but they didn't have the technology network or knew the first thing about building an application and doing it in a secure and private and compliant way. Or we knew engineers who thought it'd be really cool to do something in healthcare because healthcare really needs disruption and healthcare needs more technology. But they weren't, well versed in the industry. And so I think surrounding yourself with diverse people, again, just driving this point home is really important. If I look at our team, I think 60% of the Maple team is, identifies as female. We have folks from all kinds of different backgrounds that make up our team, and it's something we're super proud of. I really think that surrounding yourself with diverse perspectives and different folks really truly leads to better outcomes. So that would be my advice. And I still think, obviously, technology, heavily male dominated industry. I know it's tough to break through the ceiling. For me, I think what's really helped is in my time at TD, I had a lot of female role models that I could look up to. And sometimes, no matter gender, race, sex orientation, whatever it is, you need to see yourself in the team that you're on. For the longest time, I was the only female board member on our board of directors. Sometimes, 10, 15 folks would be attending those meetings. And yes, I'm confident and I know my stuff, but it wasn't until we got our second female board director where I could just kind of, breathe and relax. And that's when I realized how important it is to be able to see yourself in the teams or organizations that you work for. And I think that's super powerful.
Oh, that's great. Thank you. Yeah, I agree with what you're saying is, surrounding yourself with, strong women, strong leaders, and women that you can look up to and see, yes, they are helping to break down these barriers. And, I could one day also potentially, be in those types of positions. At OCI, we're very lucky that we have, two very strong females in senior leadership roles. We have our VP of Business Development, and we also have our President and CEO are both very strong female leaders. And I think it's really important for, those that work within the organization and that are touched by these organizations, have the opportunity to be able to be exposed to that and see how they've been able to impact the ecosystem. So that's great. Thank you, both of you. We're going to now move on to some questions that have now been posed in the chat directly from our participants. So Ashleigh, we'll start with you. Do you think that there's enough work being done right now to get women into the tech industry?
I think it's starting. It's exciting to be part of the momentum. I think that this generation of kids are going to have a really good opportunity. There's going to be more opportunity provided for women moving into technology for this generation. We're doing an awesome job promoting STEM in specifically targeted at young girls in high school and even in elementary school. So we're doing a great job there. The leadership in technology is pitiful in terms of the representation of women. We need to do a much better job at bringing women into leadership in this industry. 5% of tech companies in Canada have a female CEO, a solo female CEO. With tech moving into areas like healthcare, I think we're going to see a lot more opportunity for women to move into leadership. But like I said, I think we're starting to make good progress. A lot needs to be done. I think as women, there's a lot that we can do. So I think that we can, seize opportunities that are put in front of us, even if we don't feel like we're 100% qualified for those opportunities. I think we can be more vocal about demanding those opportunities, about demanding equality in pay. And I think that our allies, so men who are leading these technology companies predominantly, they're starting to do a great job being allies, calling out women who are doing a good job in their roles. But the idea of coming alongside women as an ally is really important. In STEM in particular, women are 45% more likely to quit after 1 year than their male counterparts. And I think if we did a better job in mentorship, in becoming allies to young women who are coming into the technology industry, we would have women sticking around longer. So the last thing I think that we can do as parents is to ensure that our girls have equal opportunities to fall in love with STEM and to really grow into the leaders that we need. So I've got 2 little boys and I've got 1 little girl, and I can give my boys a radio and a screwdriver and I can leave them for 2 hours and they'll deconstruct the whole thing and build it again. Madison needs to have some sort of human or component tied to the technology. She needs to have, some value proposition that has a bigger impact than just taking something apart. And so that's what I say when, technology and healthcare, that's such an awesome spot for women to lead. Technology and, self-driving cars. There's all these cool opportunities that I think we're gonna start pursuing harder to be in leadership in these types of roles. But our job as parents is to make sure we have equal opportunity for kids to fall passionately in love with technology, and that we're really careful in how we talk to our children to ensure that girls don't have a ceiling put on their career aspirations, whether we mean to have that or not. I think the words that we use, the way that we model, our role in technology has a big impact on our little girls.
Oh, I totally agree. My daughter, it sounds like she's very similar to yours. She needs that human interaction, but I'm so grateful that the world has changed so much since I was a little girl that she has the opportunity to do, coding, and the opportunity to make these little robots and do different science experiments in class. Who knows what other things that we would have done if we had that exposure. So I'm so pleased to see these new things being implemented to further stimulate opportunities for girls, for young women. So thank you so much, Ashleigh. Roxana, what are your thoughts? Why do you think it's important for more women to join the tech industry?
I would echo a lot of Ashleigh's comments for sure. And just going back to my, point about diverse teams, I think it's really, really important to be able to hear from as many different perspectives as possible. A lot of what we talk about at Maple in terms of building strong teams, we like to encourage healthy debate, and we like to encourage conflict, positive conflict, right? Challenging the status quo, bringing different perspectives, different angles. And I think that's really important when you're building a team together, right? If I don't play many sports, but if you can imagine a basketball team, everybody has different strengths and different traits that they bring to the table. And we have to rely on each other to complement each other, to build something greater, united. So another, again, and my experience, right? And I think I've been very fortunate to have two other co-founders, because I've really lived it, to see, you know, where they're strong and I'm not as strong, they lift me up. And where they're not as strong, that's where I come in. And the biggest, honestly, testament, and our CTO, I think he'd be really happy if he heard me say this, but over time, like initially, you know, you have three super type A, super passionate people wanting to build this company. And, you know, there was some headbutting early on. But over time, as we got to understand our styles, and because we truly respect each other, the greatest compliments Stu can give me now, he'll say, I have to defer to Roxana on this one. I get, you know, my next steps and course of action from Roxana, whether it's, you know, dealing with, you know, people management situation where you have to bring a bit more empathy, a bit more understanding. And of course, I don't want to stereotype, but everybody has their strengths and weaknesses. And I think knowing what yours are, knowing what your teams are, and figuring out how you can support each other is really key.
Wonderful. Yeah, totally. Definitely agree. So Roxana, bringing it back to you with the next question, you know, how much do you think the industry has changed since you joined?
I think it's changed a lot. I mean, even in terms of, I guess with respect to women, Ashleigh, I think you have some great stats. I would have some similar stats. I think we still have a very long way to go. But people seem so much more open to have these discussions, very open, very transparent, very authentic. Speaking about mental health, I think as a result of the pandemic, people have just started being more comfortable talking about the challenges that they're going through. And I think that's a wonderful thing for us, being a company that cares about people's health and well-being. We put our employees at the forefront of everything we do. And so we have, you know, we try to encourage as much transparency and as much flexibility as possible so people can talk about their issues. And from a leadership perspective, you know, we do a ton of industry scans to say, what are some of the best in class companies doing when it comes to mental health? What are some of the best in class companies doing when it comes to recruitment and diversity? And I think we're doing a good job, but we still have a really long way to go. I look at, you know, we do have quite a few investors, and they're all fantastic. One of our key investors, Acton Capital, which is a VC company based out of Germany. Just this morning, I didn't know they were doing this. I woke up and they put this post on LinkedIn highlighting all the amazing women, female founders from their portfolio of companies. And you know, they had Joanna Griffiths from Next and all these other wonderful women. And sure enough, there was a picture of me. I don't even know where they got it from. I didn't know that they were posting it, but it's just so nice to be able to get that support. And I think many organizations, including investors, are looking at companies with a female founder as an asset. Earlier on in the days, I would go for networking dinners, and, you know, more males than females. And I would hear founders talk to say, you know, we have still yet to hire our first female, and we're a team of 30 people. And I couldn't believe it, right? And but at least they were having the discussion, and they recognized it was a problem, and you know, figured out that they should do something about it. So I think there's a lot more openness, and the ability to talk about it, and the willingness to make a change, which I think is great.
Well, thank you so much. Yeah, I totally agree. And then moving on to you, Ashleigh, if you want to talk a little bit about, you know, same thing. And I think that, you know, what's changed since you've joined the space. I mean, you just telling your story just now, saying that you have 3 kids and you are leading a startup. That is a vast amount of work. That is amazing. So if you could talk to us a little bit about, you know, sort of, you know, what's changed, you know, once you sort of entered the space.
Yeah, so I think even in the past, maybe talk about healthcare first, even in the past 6 months, healthcare has evolved significantly in our field in digital therapeutics. We've got 6 or 7 new billing codes that support remote monitoring of patients. In the United States, there's billing codes being established in Canada, and that really unlocks the door or opens the door for these type of remote therapeutic solutions to be adopted. We can't move forward without partnership of our provincial and federal healthcare system and the healthcare system in the United States. So the landscape is changing really quickly in healthcare. I think the pandemic has been a real proponent. Well, obviously, it's been a real proponent to putting consumers in the driver's seat of their healthcare. And we've tasted that, and we're not going to go back. All my kids' doctor's appointments are virtual, so I am not sitting in traffic again to go and see their pediatrician. I will do virtual unless absolutely needed. So the landscape in healthcare has changed dramatically in the past 3 years since we started Neurovine, but even in the past 6 months, we're seeing a massive shift. What's changed? I was part of the question, what's changed in our house to allow this company to be built with 3 small children? So I attended a conference when I was just starting this company, and it was a women in tech conference, and one of the speakers said, the best career decision I ever made was my selection in life partner. And I have to say, having a partner who is able and willing to take half of the workload at home so that I can pursue the things that I'm really passionate about has been essential. I can't be the only one running our home and the only one running our company. And so it really does take a village to be able to make sure the kids are well cared for and to make sure the company is well cared for. And my partner has allowed that to happen. The pandemic, again, has, I think, pushed women to new levels. And I think we have seen, what we're capable of in terms of multitasking. I'm really, really thankful to be back in school now.
I think that's an understatement.
Yeah. I think that's the biggest thing. I've just been fortunate to have the space that I need to build this company because we've made space at home.
That's wonderful. And, so I fully agree, with your comments, Ashleigh and Roxana. Surrounding yourself with the right people that are encouraging and empowering you to do what you want to do. Yeah. It is not easy starting a company, or even thinking about starting a company is a very scary thing. Because there's a lot of work in it before it starts to pay off. Thank you so much for both of your stories. Very, very exciting, very, very helpful. I'm not sure if you have any questions that you'd like to ask each other, or this is a perfect time that I'd like to ask both of you to be able to plug your companies and your social media in the chat. And then this way, those that have attended the session can reach out to you separately.
That sounds good. Our email address, or?
Whatever you would like.
Awesome.
So maybe just your Twitter handles or social media of your organizations in particular. It's a good way to drive some more traffic to your companies and what you're able to be providing to the ecosystem. Yeah. And I have to say, Ashleigh, I fully agree about the strides that we've made even during the pandemic on changing of billing codes, the Ontario Health Systems, the Ontario Health teams, and how they're now more active in the space. And this is the time right now that we're all working together to embrace our own health journey. Having the opportunity to just use your phone and speak to a physician in real time, to support your children, which is amazing, and not having to constantly take them out of school or online learning or whatever, specifically to, help them in whatever that they need, as well as ourselves, giving ourselves that time to focus on our personal health. So very important to not only, everybody be working on, better patient outcomes, but what about ourselves, outcomes for ourselves too, as women. So thank you. So that's all the time that we have today. I want to thank you all for this particular conversation. I think it's been wonderful. We hope that everyone has joined us, has gotten a lot of wisdom and leadership out of this particular panel. And if we have time for any other questions after the fact, feel free to reach out to us at OCI, and we're happy to make further connections from there. So I just want to say thank you again to everybody for participating today. Happy International Women's Day. And again, please follow us at OC Innovation or join our newsletter at oc-innovation.ca for latest news about what's happening in the Ontario ecosystem. Healthcare startups such as Maple and Neurovine is where you would find out information about those types of companies. And again, thank you and have a wonderful rest of International Women's Day.
Thank you so much, Jen, and everyone involved. And thank you, Ashleigh. It was so great to meet you and hear about all the amazing work that you and Neurovine is doing.
Yeah, you too, Roxana. It's really great to see Maple. It's kind of taken off right now. And Jennifer, thanks again for the opportunity to talk about this. It's an area that I'm personally very passionate about. So really appreciate the opportunity.
Wonderful. Thank you both so much. Have a great day.
Thanks, you
You
too.
too. Bye now.
Bye.